This is a big deal, right? How do we knock down the barriers? And I think we've been talking about it throughout the course of the evening. We have access issues, and many of the reasons that we have access issues is that there are barriers. There are barriers related to funding, program, systems, stigma. What I'd like to do is I want to deviate a little bit from our program. I'd like to have each of you give a short description from your perspective about the key barriers to getting care, the problems with access, and then I'd like to open it up to the audience. We don't have a lot of time here, folks, but I want to try to get the audience to ask a few questions that we can field. So we can start down there with you, ma'am, and you can talk to from the family perspective. What are the barriers that are most problematic for you and all of the people you represent?
Is my mic working? Yep. I'll begin just real briefly because I've been in this arena as an advocate for more than 20 years as a profession. My background is public relations, but I really began as a mother. And this is 27 years ago. My then 8-year-old son had a psychosis, and back then, it may be hard for some of you to remember, children didn't get sick. So it was definitely the mom or something else going on. And so getting care for my son, my oldest of 3, was a real challenge. And I know that's probably not popular in the current gun culture, but I'm from Tennessee, and I used to call myself a double-barrel shotgun. One side was I was a mother, and the other side I was an advocate. So what I learned very quickly was, what do you do not to rely on the system because it didn't exist? And sometimes, frankly, I think we really expect this. This may not be politically correct either, but sometimes we expect the system to kind of provide for us. It's very important that we get what we deserve from our communities. But in my experience, there was no system. There was one child psychiatrist in the whole state. And there was just nothing. So I had to get really innovative and build relationships. And I really, to this day, believe that's really a key, is finding those champions. I call them my healing team of angels and saints who could help me help my child and figure out how to navigate what was a beyond difficult situation. And he was one of those children that didn't turn his anger outward, he turned it inward. So suicide for an 8-year-old was like a constant battle and what we struggled with. And I'm going to move to the bigger question, but I did want to say I think it's very important. I was working with HBO on a film that's coming out next week actually on this issue. And I think it's really important that we not lose hope because you just never give up. And if you don't, things will happen, some things will go bad, but sometimes one of the barriers we have is that sometimes I think we are afraid to share the success stories too. And in my own experience, my son has done very well. He had struggles, but made it, went to college, works for Microsoft, makes more money than I do. Don't know how I feel about that. But is married, is a father, has friends, is a great brother, a great son, and a great human being. Thank you. And so sometimes it's hard to share that because sometimes people almost get angry with the success story, which is really weird. So I feel like there's a lot of wisdoms to teach from people who have managed to navigate. Back to the barriers issue, I think one of the biggest barriers is really lack of community. And I'm not going to talk about systems barriers because there's a lot of experts here who can really talk about what those are, and we know what they are. I began my career at NAMI as a PR director in Tennessee because I didn't want my son to have the same outcome that I saw other people have. 20 years later, we're almost having the same conversations. And it makes me really sad. So what I've done is dedicate the last couple of years of my professional work much to the credit of my CEO and bosses and board of directors to really reaching out to people outside of the mental health community, because I think it's going to take people in corporate America, brands, private sector, thought leaders, influencers. I work with a group called, my name for them is FAMES, Film, Art, Music, Entertainment, and Sports, making sure that those conversations are happening vividly, loudly, everywhere they can be, so that the more stories that can be out there, the more we can normalize and eliminate some of the shame and the secrecy that we have about talking about these conditions and these issues, that the more we're going to begin to combat the barriers that exist. And the last barrier is really around, I think, our challenges in working with the next generation and young people. And I say our role as older, wiser maybe, advocates is to be encouragers and encourage them. They have great ideas, better than I can come up with. So switching the role of saying, we're going to bring you into our world, and maybe thinking about how can we encourage you to be the leader. We need you. You know, we're going to run out of gas at some point. So those are my thoughts. They're really not systems barriers as much as they are community, just cultivating empathy, cultivating champions, and cultivating a community that's honest and open and caring.
Thank you very much. Just to reflect on your last point about the role of the young people, as I was saying in my opening remarks, we actually have a couple of young people here to finish this thing off, and I'm dying to hear what they have to say, and we need to bring them in to our design work, as you said, and that's what we're doing. In fact, this whole month is focusing on young people and how they can inform our system and demand a new era.
Yeah.
Speaking of systems, I'm looking at my colleague Toby Ewing, who's the executive director of the Oversight and Accountability Commission for MHSA, and your role is to help oversee and push the transformation of mental health services across the state. So, in a brief period of time, if you might identify the key things that you would like to see get knocked out.
Well, first I'd say I think we need some more double-barrel shotguns. Because that's how change happens in our community. You know, so I'm not a clinician, but when I talk to clinicians, there's this overwhelming sense of, in most cases, in the vast majority of cases around mental health needs, we have the tools and the strategies and we know how to support people. There are exceptions and there are outliers there, but that's not happening. And I think that the state of California needs to establish a policy and a practice that everybody who needs care gets care as a foundational step, right? We don't have that today. And consistent with what you heard from Congressman Kennedy and Mayor Steinberg, we need to figure out the right strategies in terms of the role of the private sector, insurance systems, the role of the public sector. I think unlike other areas, we've made it very easy politically and in our communities not to solve this problem. We need to make it easier to solve the problem and harder to fail. Right now, as the stories that we've heard today, the stories we see every day in our communities, in my own family, it's very easy to sort of get caught up in the disappointment and to see that as acceptable. And there are lots of us who are recognizing that that's not acceptable, to use your analogy of that double-barrel shotgun, right? But as Mayor Steinberg said, if this was someone we saw with a physical health need, it would be absolutely unacceptable. But when it comes to mental health care, half measures are enough. And we have the tools, we have the resources, we have the creativity. The commission, consistent with your comment, in February, John, you were there, we engaged in an innovation summit, first ever innovation summit for mental health. We brought together county mental health directors, youth, providers, family members, and we reached out to California's innovation sector, in part because we wanted them to help create permission for our public sector leaders to try new and creative things. But we also wanted to break down some of the barriers of understanding and stigma. And if we step back and think about the resources that California has, they're fiscal resources, but it's also organizational capacity. It's the creativity. It's the ability to bring new people into the conversation. I think the biggest barrier we have is we're not doing that sufficiently yet. We're continuing to anticipate that the system we have, if we can just grow it bigger, will be able to address our needs. We can't buy our way out of this problem in terms of public mental health dollars. What we really need to do is change the way our system is designed, change the way we think about expectations, be very clear in what we're trying to get done. And if we start with this idea that everybody who needs care gets care, and I'd say that thanks to Mayor Steinberg, the Mental Health Services Act says the goals we have for our mental health system, in many people's minds, aren't even mental health goals. They're goals for humans. As someone said, this is about human needs. It's about being safe. It's about having housing. It's about having our families intact. It's about children succeeding in school. It's about having a job. In my family, I have a family member, when he's working, we know he's well. When he loses his job, that's when he hits those stress points. That's when we're concerned about suicide. That's when we're concerned about his mental health. And so if we reframe this conversation in terms of what it actually is we're trying to accomplish for people and for families, I think we can think differently about the resources we have and we can get there.
Thank you, Toby. Kurt, you come from a really, really important position here in the conversation at disability rights and the fact that that access to care must be a civil right. And I would love to hear your perspective on this conversation and the issue of barriers through your lens.
Thank you, John. Thank you for the invitation to join all of you all the way down here in Los Angeles. It's always a pleasure to come down here. I think you hit upon what I think is a very important and key point of our organization and that we believe is essential to really changing the culture of behavioral health treatment in the state and nationally. And really, I think that mental health is a health issue. Yes. And mental health is a disability issue, and mental health, therefore, is a civil rights issue. And we need to think about mental health as indeed a civil rights issue and bring some of those strategies, tactics, and importantly, understanding to the discussion as we talk about reshaping, restructuring, and resourcing the entire system statewide. Another thought that I think is related, maybe Toby and I have been spending too much time together, but oftentimes what can determine beyond just that public understanding is the political commitment and then the political structure behind that political commitment to make the system work. And Prop 63 and a lot of legislation following, before and following that, have really helped set up a structure, but not a structure right now that I would submit contains the leadership that it really has to have at the highest level to make that happen. For, I think, a whole host of political reasons, decisions were made that locally we would design our systems and have those systems closer to the communities. There are upsides and there are downsides to that. And the downside is we've got 58 different systems, some with greater capacity, greater sophistication for leadership, and like I think Dr. Sharon brings to you all here in Los Angeles, every county does not have that. And from our perspective, it's really a disappointment to see that the level of services would depend on a person's geography. And so I think for that reason, we need to continue to keep in statewide leadership some sense of leadership, direction, and commitment to the program. And I guess one other piece that's maybe more on the practical side, that as we look at a whole host of problems affecting persons with disabilities in California, it is suddenly seeming like all roads are leading to supportive housing, or the lack thereof. And I think right now that the crisis we have with housing in California, in many cases, I think really changes both in the commitment on mental health and what we can provide on services, but actually exacerbates it. And we need to ensure that we're providing more of that supportive housing and the services that go behind that. And as Judge Bianco was saying, earlier, tools such as mental health courts and using mental health courts effectively, I think will ultimately help to bring the system around.
Thank you very much, Kurt. Okay, I think there's like a 7-minute break or something, and we're going to flush that and use the time we have left. I think there are a couple microphones going around. I know there's probably a million questions, but someone with a microphone, find a raised hand and hand it over. Okay, go for it.
We can hear you.
Yes, I'll just be loud, because I don't think this is working. One of the things I'm concerned about is the money that is from Prop 63, that right now there's a concerted effort to take that away from the seriously mentally ill and to divert it into housing for all. And there was a bill that's tied up in court, thanks to some very industrious and active mental illness advocates, because the ability to do supportive housing through Prop 63 is already written into law. And now they want to put a proposition under the false idea that we'll be helping those with mentally ill. So I'd like to hear some comment from that on the stage, because it seems to me that's the elephant in the room right now. Because we'd love to spend this money, get this money spent on the seriously mentally ill. The other question I have, and that's the one, and I'm sorry the judge is not up on the stage right now, but he mentioned someone who was in jail for sleeping in a parking lot, facing multiple misdemeanors. Because he's mentally ill, he can't be on the street. He's being persecuted. Rich people don't get arrested for sleeping under bridges or sleeping on parking lots. It's the poor, it's the ethnic, and it's the mentally ill. When are we going to stop the crime of arresting people and incarcerating them for sleeping in the wrong place? Thank you.
Well, I guess I can try to address those massive questions in a short way by saying that the investment in housing and living environments is, I think most people would agree, is critical. And what we need to do as mental health departments at the county level is make sure that the housing that's being provided to individuals is being provided to those who have serious mental illness. I took this job 1.5 years ago. It does feel like 15. And I can tell you that I'm laser focused on that. And I think that the folks in the department and in other departments are aware of the fact that that I'm a stickler about that. And what we are doing is we're setting up clear systems and involving our auditor as well as our county council to make sure that the housing that comes from MHSA dollars is for folks who have serious mental illness.
The question is about them in the legislature wanting to take that away from you.
Oh.
And that's the issue that's on the topic. They got
Well, we do have Mayor Steinberg here, and this question may exhaust all the time that we have, but while come on up.
Respectfully, sir, I get to your question. I know it's
I hope you don't mind that
controversial,
we're not
but I
taking-
have a very different opinion because I'm the author of the housing measure. Here's what we did. Prop 63 is not indexed. It grows every year. It's growing from $1.5 billion, $1.7 billion, $1.9 billion, $2.2 billion, $2.5 billion. We did say we took a set amount, $130 million, and set it aside and said if we use that as a repayment stream, we can create a housing bond of $2 billion. And by the way, the $2 billion can be leveraged with other housing funds by about 5 to 1. That's $10 billion worth of housing. And yes, we made that choice because services without housing is completely wrong. No, housing without services doesn't work, and services without housing doesn't work. We need both, and that's what we're seeking to do.
Maybe after this, you can have a little chat afterwards. As far as arresting people for doing things that make that when that shouldn't happen, which is a regular occurrence here across the state and around the country. The County of Los Angeles, across multiple departments, is trying to put into place more and more diversionary efforts. We're doing a ton to train first-line responders to say, look, this is an individual who needs help and needs care, not punishment. We're in the process right now of re-upping our efforts as a department to assist the sheriff and the Department of Health to identify individuals who we can get out and get into care. These are major, major problems. They're major struggles, and we are focusing on them. And I pray, and I'm completely committed to seeing them change. No, believe me. Hi.
Sorry to cut you off. I know there's not a lot of time, so I just wanted to say something. So I work in the Department of Mental Health, and I worked in JJPAS, which is the Juvenile Justice Aftercare Program that started, and I'm not sure if that's going to continue anymore. And then I switched to working in the camps as a clinician in the camps, and now I'm working with AB 109 when people are released out of prison and connecting them to providers. So just a few things is, I think the link to the community is huge, and I think that's like the core thing. And I had an idea for the program for the camps, but I feel like a lot of times the clinicians and the actual firsthand people providing the services, our thoughts and opinions aren't really getting out there because we see where those gaps are, So one of the things is, in the aftercare, I would see the kids in the community, but they didn't know me. They're like, who are you? I don't care who you are. Who are you? So I couldn't really get them bought into the idea of mental health or even just helping them when they're out. And then when I went to the camps and I worked with them, they're like, Miss, dude, we really want to see you when we get out. Can I see you? And I'm like, sorry, I don't go into the field. So it's like having that link from in the camps to out in the field, so we could be field-based, we could be camp-based, in the camp, and then half the time in the field, because I would see the parents, we do family sessions in there, but it's not family therapy because I'm not in the home. So I wasn't really getting to see the dynamics of the home or what my client was even trying to describe to me. So really being able to get into the community and work with them when they came out, for me is like a huge part of it. And then, talking about early prevention and that community link, the schools, they would come into the camps reading at first, second grade level, and not getting them linked to good education. So it wasn't a question, it was just a statement that's the idea I have for the program, for the
My
camps.
name is John Sharon. I have an email called jsharon@dmh.lacounty.gov. You can also write it to director. You're in my department. I go out. I've been out in the field collecting ideas, and I will continue to do that so that we can drive our models based on the needs of our people, because we listen to consumers and those who are providing frontline care. So please send me your email. I agree with everything that you're saying and trying to move things in that direction.
Let me add something on this issue of kind of how we capture ideas around reshaping programs or how we capture the voice of the community members. If you're not aware, under the Mental Health Services Act, there's a requirement that our system be innovative, and there's about $100 million a year for that. And that's right, what? She says, what? And so we're trying to support the ability of the counties statewide, and Dr. Sharon's been a phenomenal partner in this, to really think outside of the box. And so the commission is putting together a strategy around youth. And what we really want to do is first do some listening sessions around the state. What are some of the core challenges facing our youth and young adults in terms of the mental health system, right? Really get it from the folks who are experiencing these needs or who are in this field. And then we want to bring together some corporate partners, folks from your FAME group, right, along with others, because sometimes it might be a communication strategy. It might be how we tell the story. It might be a technology issue. And our hope is that we can bring together through some innovation summits, some conversations around creative approaches, that we can empower young people to then pitch those ideas to our community mental health leaders, right? And for a couple of reasons. One, we're looking for those better ideas, because I think what you're hearing is some of our systems haven't been tuned up as much as they need to be. But we also want to address some of the stigma and the discrimination and the lack of awareness by changing the conversation about what we mean by mental health care. It doesn't have to be a clinical appointment, sitting for 3 hours waiting to see, someone who doesn't look like me or someone who isn't the right person for me, and really think differently about the resources we can bring into these partnerships. So over the course of probably the next 15 months, we're going to try to figure out, and we'd love to continue to partner with LA County and possibly do one of these listening sessions down here to really understand what some of these challenges are and how we can address them.
That sounds great. We have time for another couple of questions. And if you work in the Department of Health, please save them for me outside of this forum.
Good afternoon. I'm Dr. J from the Inglewood Unified School District, and I'm speaking for educators. I'm also, I think, an undercover panelist up here because I want to bring, I'm on the boots on the ground, working with students, spent a lot of time in Compton, now in Inglewood, lots of things going on, trucks and dirt and lots of things being built. It's a sports town, but it's also stress. And our scholars are wonderful. But I'd like to encourage those who are educators in the room to think about partnerships. And I've heard you say this before, because we can't fix it looking and complaining about not a counselor and now nurses, who is not involved. I think it's really time for us, and I do believe that this conversation is a catapult for that. For educators to reach out and work with our health friends, our thought partners, to come in and see how we can bring innovation and opportunities. We're paying a price now for bringing arts out of the schools from years ago. We're paying that price now of music not being there, creativity not being there, opportunities for scholars to speak and to engage and to get involved in community. And community is so much more than just those in your 5-mile radius. I believe it's just being able to give exposure to our scholars. So my question is, how are you, and I came here to meet all of you, so I plan to meet everybody. So if you are someone who would love to partner with us, we're doing great things, and I'm excited because I am building a health and wellness team. And we're going to make sure that every family gets engaged. And our scholars want it. But I don't think educators reach out to you. Do they call you? I know I do. You might have gotten my call. I just already hooked you up, sir. You're going to be speaking next month. So for the rest of you, I'm going to get to know all of you in here today. Because if we don't reach out to you to say our scholars need help, our scholars need some conversations, opportunities to be creative, then we are at fault as well. So what do you see that you're talking about breaking that prison? I hate that term, by the way. The pipeline to prison. Listen, I think it's an opportunity gap that we just need to fill.
So let me respond to this, because I love you and what you're saying. You're absolutely spot on. So when Mayor Steinberg wrote the Mental Health Services Act, he put very specifically in there that one of these goals through prevention is to reduce school failure, right? Mental health as a strategy to support educational outcomes. At the same time, that act says reduce criminal justice involvement, prevent, use mental health, investments in mental health, in care and services to prevent people from failing in school and becoming involved with the criminal justice system. That is already our policy. The problem is our practice, right? And so we currently have a project on school mental health, in part because this commission includes a state superintendent and a local superintendent. And so again, in this structure, that we're sort of like the mental health grand jury. We have educators on this mental health grand jury that are very committed to this issue. And so we've been trying to figure this out. How do we support that? We actually are in active procurement now. We're investing $30 million in strengthening school community partnerships as model programs. But that's only $30 million when we've got statewide needs across the state, right? What we're trying to figure out is how can we support leaders like yourself to have those conversations, because we think the answers are here. We think the resource is in your behavioral health director and it's in your educational community, but lots of things get in the way. And back to my earlier comments, most of that, I would say, is our culture. It's the fact that our circles don't connect as much as they need to, that people aren't stepping out of their normal course of who I talk to. We don't recognize that the mental health system actually is an investment in helping you achieve your goals. And on the other side is that school resources are resources that can help us achieve our mental health goals. In part, we spent some time with some educational leaders in Monterey who talked about how schools are actually community centers that families trust, way more than they often trust some of the mental health folks. No offense, Dr. Sharon, right? And so that relationship goes both ways, and we have to support that to go both ways. So I love your comments. Absolutely agree with that.
I do too.
I've got
Schools
one
and
more
faith-based
comment on
and
that.
libraries and much more. We're at it. I'm gonna get myself in trouble here with time, aren't I? Yes. Did you have another comment?
I was just going to say very quickly, I think that's what I'm, back to the barriers question, but also back to the opportunity. It really ultimately is about community. And when you see champions who are educators or judges or the community mental health system or families or individuals finding ways to, and private sector and all different people finding ways to have those conversations and to really build those relationships informally, if need be, is really, I think, where the promise is going to be around building a movement.
All right. Thank you very much. I wish we had more time.